Let's start with RFK Jr. His claims are, well, pretty explosive. He's saying that back in 2002, a chief scientist at the CDC was supposedly ordered to destroy data.
2002, CDC did an internal study. The data from that study showed that black boys who got the vaccine on time had a 260% greater chance of getting an autism diagnosis than children who waited, and ordered to destroy that data. And then they published it without that fact.
And this wasn't just like random paperwork. This was data from a study, reportedly, that showed black kids who got the measles shot on time had a, get this, 226% higher chance of an autism diagnosis compared to kids who waited. Now, look, for me, this isn't just some oopsie. This points to something rotten, deep corruption maybe, in our government health agencies. Agencies that, well, it seems like they care more about pharma profits than our health. Isn't it just wildly convenient when data that doesn't fit the narrative just, poof, vanishes? It says so much about these, opaque systems that I think have really hurt minority communities by hiding info about vaccine risks. RFK Jr.'s work here? Absolutely essential if we want to expose this mess and maybe, just maybe, get some trust back.
Okay, look, I understand why that sounds so dramatic, so compelling even, but let's ground ourselves in reality for a second. This whole assertion, it hinges on misinterpreted data from a study that, frankly, the overwhelming scientific community debunked years ago. It's been picked apart. To just ignore the massive body of evidence, the scientific consensus that vaccines do not cause autism, it's just, honestly, it's baffling. And my real worry here isn't just about, scientific accuracy. It's that pushing these kinds of claims, it undermines public health efforts. It creates fear, vaccine hesitancy, and ironically, that disproportionately harms the exact communities you're saying need protection. We should be using our energy, our resources on real health disparities backed by solid evidence, not digging up long-settled science because a politician thinks he knows better. I mean, really, a politician is suddenly the expert overriding decades of research? I just don't buy it.
But wait, hold on a minute. If the science is so settled, so completely unquestionable, then why would there ever be an order, alleged or not, to destroy data? If there's nothing there, nothing to hide, wouldn't you just release it all, be totally transparent? That's the ethical thing, right? It's exactly that alleged cover-up, the disappearance of data that doesn't fit, that should make anyone think twice. When information just vanishes, especially from institutions we're supposed to trust with our lives, people have every right, I think, to ask hard questions. What else aren't they telling us?
The real danger here, the immediate danger, isn't some shadowy conspiracy about one flawed data set from 2 decades ago. The danger is seeing diseases we thought we'd beaten come roaring back because people are scared off vaccines by claims that just don't hold water scientifically. Promoting this stuff risks undoing so much progress, especially for kids, for vulnerable people. Yes, data integrity matters, absolutely. But that means looking at the whole picture, the totality of evidence, not latching onto one debunked study pushed by someone with an agenda, no matter how loud they shout it.
All right. Let's shift gears. From data maybe disappearing to data that is, in my view, screamingly positive.